Welcome to the SNF Spotlight Series, your one-stop shop to find out what's really going on in SNFs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for SNFs nationwide. Welcome, Tzivya. Thank you so much for joining the SNF Spotlight.
Thank you for having me.
You started your own national Medicaid planning company called Sensible Senior Planning. Can we take a little bit of a deeper dive as to Medicaid planning and what exactly you do?
We are a Medicaid planning company, and we work closely with residents or clients that are either in a facility or looking to go into a facility or anticipate needing Medicaid within the next few years. And essentially what we do is we evaluate what their assets are, we look at what their income is, and we work closely with the families or with our client to come up with a plan. You know, there are times when, if we're working with a spousal case, if we're working with a client that has a lot of assets, we are able to do a Medicaid compliant annuity, which is ways to be able to turn some of their assets into an income and potentially save some of their assets. We just guide them through the process of setting up irrevocable burial funds and where to allocate their current, finances. Often some families will spend down paying for the health care of their loved one. During that process, we let them know about what's needed for a Medicaid application. We provide them with the education. We hold their hands in calling all of their financial institutions to get the necessary documentation for Medicaid. And then we submit Medicaid on the client's behalf. We ensure that there's an actual Medicaid approval. So we're through the process until there's either an approval or if there's a denial, we do an appeal.
So there may be people that qualify but don't know it. When would families start planning this?
As soon as you have you're thinking about the future, you're thinking about needing healthcare for yourself or for your loved one, it's always good to pick up the phone and, ask for a free consultation to speak with someone to really find out if there's anything that you can do now at this point in advance to potentially, work towards getting Medicaid, or if you're in a crisis too, to find out what there is that can be done.
Who may be eligible for Medicaid?
So Medicaid is based on assets and income, and also on medical needs as well. The medical needs in most states, it is, you have to require at least assistance with 2 activities of daily living. So, walking, bathing, dressing, medication management. And then for the income and assets, most states, the asset limit is about $2,000, and the income really varies. Some states, they have an income cap where your income can't be above like $2,349 a month. Some states have where there's no income cap. It doesn't matter what your income is. And I'm keep saying most states, because the one thing about Medicaid that's really important for people to know is that there's 50 states and there's 50 different regulations. Every state has different rules on income, on assets, and medical qualification. So it really, really is important learning about Medicaid and trying to educate yourself for your loved one to understand when speaking to colleagues, coworkers, friends, other family members, to know that every state is different. And it's important to speak with a provider or with someone who's educated in your state. Sensible Senior Planning is knowledgeable in Medicaid in all 50 states, and we do provide services across all 50 states.
So where did your love for Medicaid and Medicare originally begin?
Really, I've been in the healthcare field ever since I've been in high school. I've always worked in healthcare field. Graduating from high school, I started working in a pediatric nursing home and essentially then started a volunteer organization. I myself had my own struggles within the healthcare, and, I've struggled with an eating disorder, which in return resulted in me having a stroke as a side effect from the eating disorder. And I went into a rehab for about 3 months. And it was at that point when I really felt, some passion towards seniors and towards individuals that were handicapped. I was in a wheelchair, and you find that you're automatically treated differently. And I think coming from working from pediatric and then being surrounded more in the geriatric, I think I really at that point learned how to treat seniors and work with seniors, and how there's so many resources out there, but people don't take the time to educate people on resources. I started then working as a social service coordinator in a geriatric nursing home in the dementia unit. And I was there for a few years, did a lot of when it came to Medicaid. And then I went on to becoming an executive director, and I was administrator of one of the Sunrise Senior Livings, one of an assisted living facility. There, again, I found a huge gap when it came to Medicaid planning. Individuals would spend down all of their assets at the assisted living facility and essentially would go to a Medicaid facility, not one of their choice, whichever one had a bed. When I started doing my own research, I found that there's ways to be able to plan where you don't have to spend all your money per se in the assisted living facility. There's different ways that you're able to plan to save some of your money or use your money wisely to where you can end up in a skilled nursing facility of your choice. And just in general, I saw that, the gap of the education when it came to Medicaid and assistance that are out there. So started working with the company and then went on to start my own company.
So let's talk about the differences between Medicaid, which is federal and state funded, and Medicare, which is just a federal program.
Medicaid is a medical insurance that essentially, once you turn 65 years old, or if you've had a disability for 2 years, you can qualify for Medicare. It has deductibles, often it has premiums, it pays for doctors, it'll pay for prescription, it can pay for rehab. Medicaid is what you said, it's federal, state, and actually local tax funded as well. That is based primarily on, we said the medical necessity, income, and assets. Because, it is based on those criterias, you almost always have no cost affiliated with Medicaid. For an individual who's going into a facility, Medicare will cover their rehab stay. So they'll cover if they need rehab, or they'll cover their prescription. They may have a copay or they may have a deductible, which they usually do after 21 days. But when Medicaid will pick that up, they'll pick up the copay and deductible. And once the individual no longer needs Medicare, Medicaid will pay for their entire stay. So essentially, when an individual is in a nursing home and they're on Medicaid, yes, maybe their asset limit is very minimal. Like I said, in most states, it's $2,000. They have no other expenses, though. They have no expenses. Everything is paid for.
So Medicare is, from what I understand, is up to 100 days after like a specific injury once somebody qualifies for like a 3-day visit in the hospital. And Medicaid then covers that.
There are times when they may still qualify, but typically correct. It will cover for individuals who either don't have the funds to pay for it, or, they are doing Medicaid planning and there are ways, they may have the funds, but the funds can be used elsewhere.
You either have Medicaid or private insurance, or you're paying out of pocket. Those are like the three options.
The other option is also veterans benefits.
Would most people have their own insurance, have insurance that would cover a long-term stay?
There are some individuals that have long-term care policies that would cover. So it wouldn't be like an Aetna or, Blue Cross Blue Shield. Long-term care insurance policies can cover, if you do really great pre-planning and you put a lot of money into the long-term care, they can cover a stay. From what I've seen from my experience, they don't cover it fully. They'll cover maybe $200 a day. And as we know, it can cause upwards of $400 a day at a skilled nursing facility. So sometimes individuals have this policy, but then they also have Medicaid to supplement for the rest of their stay.
What are the guidelines for eligibility, and what's the application process like?
So what Medicaid does, and I will say again, in most states, because there are some states that don't do a 5-year look back, but in 90% of the states or more, Medicaid does a 5-year look back where they do an asset search and they'll look at the income. Essentially, what Medicaid is doing is they want to be a payer of last resort. So they want to ensure that if they're paying out, hundreds of thousands of dollars for an individual, they want to ensure that this individual doesn't have means to pay for it. So they do a 5-year look back where they ensure that there's not any money that was, so to say, hidden or money that was gifted away. And they want to ensure most states that you only have one house and one car. Some states you can't have any house and no car. Then, like I had mentioned before, they also do the income. So they want to ensure that your income isn't over the amount that they're paying. So where you can just use your income instead of using Medicaid to pay. What happens is, though, again, from an income standpoint, people hear that, and I get this so often, I can't be approved because my income is $2,500. Just so people are aware, there is a thing called qualified income trust, also known as Miller Trust, where your excess amount of money, whatever's causing you to not be qualified, can go into that trust. So, that's something else that Medicaid looks at, the income. The process is for the 5-year look back period, they're going to ask for bank statements. They're going to ask for proof of, and if you have 401k, IRA, they want statements for that. Again, most states will say 5 years. Some states say you only have to provide 2 years because we can do our own asset search. They're going to ask for the deed of the house. They're going to ask then if you're married or if you're widowed, they're going to ask for a death certificate. They're going to ask for a marriage certificate. They're going to ask for income. They're going to ask for proof of income. So essentially any financial transactions that have taken place over the 5 years. Then also there's the Medicaid application, which it varies per state, but it can be anywhere from 10 to 40 pages long. You have to fill out the Medicaid application. That'll get submitted to the county assistance office. From there, the county assistance office, it varies per state. Some states it's 30, some states it's 45, some states it's 60, some 90. They have to get back to you and they let you know, if you're approved, if you're not approved, or if there's a penalty period, meaning if you gifted money, they're saying that now we won't cover you for 2 or 3 months because you gifted money. So you have to pay privately for 2 to 3 months and then we can cover. So that's the correspondence between the county assistance office, which is what we do. We go back and forth with them. They'll ask questions. What was this $200 withdrawal? Why was that done? Why was there $500 deposited? Where is that coming from? So essentially, we do all of the back and forth. I know, and honestly, owners of nursing homes don't really like to hear all that because they want to get the private pay fund. So I was like, probably shouldn't have given those numbers, but yes.
Because they want to get private pay. They get
exactly.
They get paid more from private pay than from Medicaid?
Significantly more, like double.
Oh, wow.
But that's why we do a different thing, which I haven't touched on it at all. We do a different thing for the nursing homes. We provide different services to when we're being hired by the nursing home.
So how do you help out SNFs?
So we assist SNFs and also assisted living facilities because in many states there are waiver programs for Medicaid to pay for assisted living facilities. So we assist SNFs and assisted living facilities in a few different ways. And some of them we assist with screening. So when they get a referral and the individual does not have a payer source and would be coming in either as Medicaid pending or private pay, we do a screening. We speak with the families. We do an asset search and we give our recommendation to the facility as to if we anticipate any issues when it comes to payer. And other ways that we assist facilities is when they don't have a business office manager or their business office manager, Medicaid specialists are overwhelmed and they need assistance with processing some applications. We assist in processing some applications. Some facilities don't even have business office managers. They have just hired us and outsource all of the Medicaid applications to us. So we speak with the families, we gather all the documentation, and these are residents that are typically already eligible and we get, correspond with the county assistance office.
Have you helped people qualify who didn't think they would?
That's what we do. At 50% of our cases is exactly that. I'll give an example. Recently, an individual called and said, well, my mom has $70,000 left. She does have $35,000 left on the bank and she gifted about $20,000 too. I can't get her onto Medicaid because she gifted and she has some assets. Like, what are we supposed to do? So this situation, what we were able to do is put the remainder that she had, that $30,000, we put that into a Medicaid compliant annuity. That annuity, essential, people hear annuity, they think asset. This Medicaid compliant annuity is actually an income. It turned into an income for the resident. The resident now looks like she's Medicaid eligible because she has no assets. We put all of her extra money. She applies for Medicaid. When the family thought she'll definitely get denied, she got a penalty period of 3 months. We were able to pay that penalty period because of the gifted money that she did already. We were able to pay that out of the Medicaid compliant annuity. So essentially, the nursing home was covered and the nursing home doesn't have to worry about this 3-month penalty period because if she were to just spend down all of her money, pay privately, then apply, she would still have this penalty period. So the nursing home was covered and the family was covered because they didn't get a bill for 3 months private pay. There definitely are options out there. I say Google is not great. Going on social media and hearing from other people aren't great because every situation is so different. And that's why I always encourage everyone to pick up the phone and just, get a free consult and speak to us, speak to someone about your situation so that you can get, the actual right advice. I would say, I think what's important, anyone, no matter what age, honestly, 30, 40, 50, 60, I think education is important. I think because it even helps when it comes to where you're investing all of your money, right? You want to ensure that you're investing money that if God forbid something happen at the age of 60 or 65, you're not going to take, and you need healthcare, you're not going to have to take a huge hit. So I think in general, I think educating yourself on Medicaid so that you yourself can make an educated guess on what you want to do with your funds, how you want to invest your funds. If anyone ever wants to just, get on the phone, find out a little bit more about Medicaid and rules, it's great to just call and get a free consultation.
Thank you so much for giving us this info. How would someone get in touch with you?
Our website is www.sensible, with an S, SENSIBLE, seniorplanning.com. My email address is T, like Tom, Green, GREEN, at sensibleseniorplanning.com. The cell phone is 610-972-9400. Again, 610-972-9400. I say email, text, or phone call is always the best way to get a hold.
Thank you so much, Tzivya. It was very, very informative. Really appreciate it.
Great. Of course. Thank you.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight Series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.